Hi, my name's Loretta. I'm going to be your nurse for today. Can I get your name and date of birth? Okay, thank you. Well, Mr. Burns, you've recently been diagnosed with type 1 diabetes. So with that, you're going to have to monitor your blood glucose levels and administer insulin to maintain stable levels. I'm here today to help you learn how to properly draw up your insulin as well as how to properly administer it. Do you have any questions so far for me? Okay, well, it's really important to check your blood glucose levels because if you don't monitor it, you could possibly end up with blindness, nerve damage, or kidney damage, and we don't want that for you. So we're going to help you learn how to administer this correctly. Do you have any other questions before I start showing you how to do your insulin? Okay. Well, first of all, with the vials, you want to sterilize the stoppers on the top of the vials and create friction and rub for about 30 seconds. And you're going to do that to each bottle. Okay, then you're going to take your insulin syringe, and you always want to remember that you want to draw up the amount of air to put into the vial as the medication that you're going to take out. So today we'll be administering 10 units of regular and 15 units of the NPH. So that's a total of 25 units. So go ahead and draw 25 units up of air. And next you want to remember that when putting air and drawing up medications from the vials, you first want to inject air into the NPH because you're going to draw up insulin from the regular bottle first. So I'm going to show that to you. And I'm going to expose my needle, so I ask you to remain seated. So we're going to take the NPH vial and inject 15 units of air. And then go ahead and take your needle out. Get your regular insulin and put in the remaining 10 units of air. And then you're going to invert the vial and you're going to draw up the 10 units of air that you just put in. And you want to make sure that there's no bubbles. If there are bubbles, you might have to tap on the syringe. So we got 10 units of that. Now get your NPH and then draw up the other 15 units. So you should have 25 units of medication. And you want to remember with these vials, with your insulin vials, you want to make sure, and go ahead and cap your needle if you're waiting, you want to make sure that your vials are not expired. So always check the date on those and check for any discoloration, things like that. Okay, so now we have your needle ready, the insulin ready. So I'm going to teach you how to properly inject it. And I heard that you like your abdomen, and that's perfectly fine. I just want to remind you to rotate sides on your abdomen and stay at least 2 inches away from your belly button. So I'm going to show you right now how to do this. And you also want to sterilize. And go ahead and rub, create friction and rub for 30 seconds with that as well, and allow that to dry. And then what I'm going to do is I'm going to pinch up the skin, and depending on how much tissue we pinch, you're either going to administer at a 45 or a 90-degree angle, and I think with you today we're going to go ahead and do a 90-degree angle. So I'm going to expose my needle again and ask you to stay seated. So I'm going to pinch up. And inject at a 90-degree angle, and go ahead and inject slowly with that. And leave it in for 10 seconds. And then you'll remove it. Did that feel okay for you? And then you want to put this in the sharps box after you're done. Okay, so do you have any other questions for me? No? Okay, well, if you do have any questions, let me know. I'm going to keep your call out in reach, and if you have any problems, let me know. Thank you.